Before we begin, please know that some episodes include language that may be sensitive for some people. Thank you for joining me for another episode of The Birth Portal. My name is Connie. Today's true story is about a woman I'll call Fatima, who was planning a home birth for her second child. Fatima was 2 weeks past her due date and still wasn't in labor. We had done several stretch and sweeps, but they weren't doing the trick. A stretch and sweep is where the midwife or doctor feels for the cervix and puts 2 fingers in and separates their fingers, moving in a circular motion around the inner part of the cervix. The cervix is very vascular, and when it is soft and stretchy, it can bleed during this procedure, and it is not a concern when we see this bloody show. The sweep is when we move a finger around the outside of the bag of water and release it from the wall of the uterus without rupturing the membranes. The stretch and sweep causes the woman's body, when it's ready, to release a hormone called prostaglandin. Prostaglandin is also made into a pharmaceutical product that can be used to soften and ripen the cervix. Sperm is also loaded with the hormone prostaglandin, and so intercourse can also help the cervix thin and dilate, but only when the pregnancy is term, or 37 weeks or more. Otherwise, pregnant women would be going into labor prematurely. Nothing seemed to be working for Fatima, as she was now 2 weeks past her due date, and so a hospital induction of labor was recommended. Research shows that morbidity and mortality rates for babies born between 40 and 41 weeks don't increase. Significantly anyways. Babies born between 41 and 42 weeks have a slight increased risk in morbidity and mortality rates. However, after 42 weeks, the risk increases, and so a medical induction of labor is recommended. If a woman's cervix is less than about 2 centimeters dilated, cervical ripening is done before the induction, and cervical ripening can be done in different ways. At the hospitals that I had privileges at when Fatima was having her baby, prostaglandin gel was inserted into the cervix every 6 hours until it was thin enough to start the medical induction with oxytocin through a pump and an IV line, and that oxytocin was increased every 30 minutes until labor was well established. There are limits to the amount of oxytocin given through the pump, so therefore it must be carefully managed. Fatima didn't need cervical ripening as she was already 6 centimeters dilated on the day she was to go in for her induction. I called the labor and delivery unit in the morning to see if we could go in for Fatima's induction. However, the floor was really busy and there were no beds available. They said call back in a couple of hours to see if we could go in then. I lived very close to Fatima and went to her home for a quick check on baby, and we discussed one more option to try and stimulate labor. The homeopathic remedy caulifilum can sometimes stimulate labor when the body is ready. I was a registered midwife at the time and had some on hand. She was given a bottle and instructed to take 2 pellets every 15 minutes over the next couple of hours. I went back home, about 10 minutes away, with the plan to call the hospital back in 2 hours. Sitting around waiting for the next steps is the worst part of midwifery as far as I'm concerned. You can't go anywhere, do much of anything, other than maybe laundry, clean the house, read a book, work on a puzzle or a crossword. Gardening is out of the question, as cleaning up may take too long. Cooking, well, no way. I've had to throw out half-cooked chicken. Shopping and leaving a cart full in the aisles, well, I've done that. You could go for a walk, but I'd never be more than 10 minutes away from my vehicle. Being a midwife on call comes with a very short leash. That being said, it's still the best job in the world. My pager goes off 30 minutes after I left Fatima's home. I call back and her husband answers the phone, reporting, Fatima's contractions are strong every 2 minutes. Should she continue taking the remedy? Nope, stop taking it. I'll be right there. I notify my backup midwife to be ready and on standby. I walk into their home and I see Fatima is rocking it. Labor is happening now. I listen to the baby's heart and all is well. I check her cervix and wow, she has changed. She's now a good 9 centimeters dilated. I text my backup midwife to come and I quickly set up my equipment, drop my syringe of oxytocin, and set the resuscitation area up all in about 15 minutes. My backup midwife arrives just as Mum begins to spontaneously give us that primal grunt. Fatima's water breaks, and we see thin meconium in the fluid. Meconium is the poop from baby, and when we see this at a home birth, it is an indication to transport to the hospital, not as an emergency, but just in case the baby needs more support after birth. We see meconium about 25% of the time in term women in labor. The meconium is diluted in the amniotic fluid, and the more amniotic fluid there is, the more diluted it is. If there's less fluid, then it can become thick and more of an issue for the baby when that thick fluid is drawn into the lungs. Babies, when in the uterus, actually make small breathing movements where the amniotic fluid is drawn into the lungs as a normal part of development, and then they also pee it out into the bag of water. It's an incredibly amazing cyclical process. It is not safe to transport Fatima to the hospital, and she is doing a great job pushing her baby down. She reaches down to feel the baby's head, letting out a squeal of delight, bringing tears to my eyes and everyone else in the room. Over the next few contractions, we don't see much progress, but the baby's heart is fine. Mum is holding back on her pushes. She says she is scared of the pain. Something is wrong. Fatima had an epidural for her first labor and didn't feel the burning ring of fire. I explained that it is a normal sensation, and it feels like your body's ripping in two, but it's not. Your body's opening beautifully. Trust it. Say out loud with me, I can do this. I can do this. Fatima is gripped with another contraction and feels her baby's head and body emerge in one motion. She pulls her baby up to her chest. Unfortunately, the baby isn't wanting to breathe, and the body is flat and limp. I say we need to clamp and cut the cord and bring the baby to the resuscitation area. And as soon as we lie the baby down on the heating pad, it begins to scream and cry. So the baby's brought immediately back to Mum's chest, covered in a warm blanket. The backup midwife and I look at each other and give high fives. And we call the hospital to say we won't be bringing in our client for her induction, as she just had a wonderful home birth. Thank you for joining me for another episode of The Birth Portal.